I'd like to first of all thank the Australasian Society of Aesthetic Plastic Surgeons for inviting me to present my experience with hair restoration to this group. Well, we know that hair loss affects tens of millions of people worldwide. It certainly involves both men and women, and not just limited to people who are in the public eye. Hair restoration is actually, when we think of a global hair restoration market, it's the largest, fastest growing segment in the aesthetic space. And we can look and see that in 2010, a little over $1.75 billion was spent on hair restoration globally. Literally 10 years later, that was roughly 3 times as many people. And it's estimated by 2025, probably over $30 billion will be spent on hair restoration globally. So it's definitely a large growing market, and also it's an untapped male aesthetic market as well. Well, in the past, in 2006 and earlier, the only option for most patients was what's called a strip procedure, an FUT. This is where we removed a segment of scalp from the back of the head, closed it with sutures, and divided that up into follicular units. But now with the on-grade and the upgrade of newer systems, the FUE systems that I'll talk about a little bit later on this morning, we're seeing the FUE method, or follicular unit extraction method, with these newer devices has gained more and more popularity. As market awareness has increased, we actually have seen them cross. At about 2014, it was almost 50-50. And in 2016, we could see that FUE actually overtook FUT as a preferred method of hair restoration. In fact, that gap has continued to widen even further. Most patients today that come to see me for hair restoration are not interested in a strip procedure, and they're interested in something less invasive. And why is that? Well, part of that is an example of a patient of mine, a young guy that had come in. He had had an FUT procedure done in the past. He sized a large area of scalp, and obviously it was probably closed under tension. We know as plastic surgeons that if a 5mm wound is left open and there's some tension of 5 millimeters, when you close it, it's going to widen by at least that amount. And certainly in younger people that have relatively inelastic scalps, the likelihood is that that scar is going to widen and also limit the donor area as well. Now, in response to that, there were earlier devices, manual FUE devices, that had a larger punch. And unfortunately, it's another patient of mine who had a manual FUE done years previously, leaving significant atrophic and hypopigmented scars throughout those areas. You can see the difference when you look at the NeoGraft FUE scars, which are much smaller and is shown there is in the pink and red, as compared to those larger scars of the older manual FUE devices. And this is obviously what patients do not want to look like. We've all seen people like this. Patients have this in their mind that when they go for hair restoration, it's potentially going to create a very unnatural look. And that's because we think differently today. I think with newer devices, we're individually selecting follicular units, and this is what they look like. We're taking these with a tiny punch, literally under 1 millimeter in diameter, and we're simply extracting each individual follicular unit to be used in the hair transplantation process. So what is the procedure that I use? Well, the first procedure that I've used for a manual FUE was a NeoGraft, and the NeoGraft I think is a great device. It utilizes a small punch, often under 1 millimeter in diameter. We shave the back of the head, the donor area, and then after that area is shaved and prepped, we'll place a local anesthetic. So again, these procedures are done under local anesthesia. After the anesthesia is applied, then we're simply harvesting with a very small punch, as you can see, and connected to the punch is a suction tube and a reservoir. And so the way that the grafts are removed is the punch captures the follicle, and then as we're beginning to suction it out, the sharp end of the punch actually excises the follicular unit below the base of the follicle and is suctioned up into the tubing. So it's a relatively rapid procedure. We then obviously design the hairline. Small openings are made either with the NeoGraft device or with a small needle or a scalpel, and the grafts are placed in position. And at the end of the procedure, you can simply see that the grafts are in a good location. So the NeoGraft process, in simplest terms, is designing the hairline, shaving the donor area down to a 0, harvesting the grafts with the NeoGraft device, and this is what the follicular units look like, creating recipient sites, and then implanting those grafts into the new hairline. Now, the other exciting development in hair restoration has actually been the development of robotics. We know that robotics in medicine have been around for decades. In fact, there are over 70 companies that developed a robotic technology to be used in medical intervention purposes. And we know millions of patients have been treated for a variety of conditions worldwide, and actually the public's perception of robotic technology is very positive. We estimate that probably the robotic market might quadruple over the next 5 years. And the device that I utilize for robotic hair restoration is called the ARTAS iX. It is really the newest and most exciting robot available for hair restoration. And the reason why it's a great device is it allows for harvesting as well as recipient site making and even implantation. The stereoscopic vision system has 2 cameras within the head of the robotic arm, which houses the small punch and scans the surface of the scalp much faster than the human eye, looking for the most ideal follicles. The harvesting process is rapid, so it reduces work fatigue and procedure length, and it does it in the most random pattern possible within microns of accuracy from one graft to the next. So what does a procedure look like in real time? Well, you can see here the donor area has been shaved down, and we've placed a skin tensioner on, and that stretches the skin, and this is the actual robot harvesting the follicles. Now, this is the process of actually implantation. This is a 2-step process where we actually make an opening, and then the small grafts are individually placed in both in the frontal area and also into the mid-scalp region. So essentially in my practice, I like to utilize a hybrid hair restoration, and that combines both the ARTAS and the NeoGraft FUE devices. I find this applicable in most cases. The ARTAS advantages are great for both harvesting and site making because we have a device that can very rapidly harvest and make sites in a manner that's literally within microns accuracy of one another. The site making is done, and so it actually avoids existing good terminal hairs, so there's less damages to surrounding hairs. But I still do utilize a NeoGraft in a significant number of cases in addition to the robot, because I feel that the NeoGraft will allow me to maximally harvest in the donor area. There are some areas that the robotic arm may not be quite able to reach by the angulation or hair direction, and that's where a semi-automatic handheld device is very helpful to have as well. And also there are certain scalps that are more responsive or sensitive to robotic manipulation than others. So I feel like this hybrid hair restoration that we utilize today provides that combination of robotic precision and that handheld artistry that I feel that the NeoGraft does provide. So what does that look like in real terms? So, you know, one of the things that we learn in dermatology and plastic surgery about facial aesthetics is just like the chin frames the lower part of the face, the hairline frames the upper part of the face. And if we don't have a hairline, as you can see, or a very poor hairline, as a patient demonstrated on the left-hand side, our eye tends to fall to the very top of the head. The head looks longer, it looks more aged, and the patient looks obviously much younger once we've created a hairline, because that frames the upper part of the face. And you can see it's a very natural look. These are individual follicular units that are placed in position. The hair grows in a very natural manner, and even if the hair is wet or combed, it looks very, very natural. There's no pluggy look, because essentially we are placing the grafts back into the scalp the way that they were originally there. This is a much younger patient, probably about 20 years younger. You can see the difference in his aging. And and how simply framing someone's face and creating a forehead makes that patient look considerably younger. Again, a very natural look. We want to preserve and maintain the existing hairline. The other nice things about the FUE is, as a device, we can utilize it to camouflage existing FUT scars. So scars that were created by a previous strip procedure, we can easily improve by harvesting some of those grafts and placing them directly within the scar. We also can utilize the FUE procedure for treating facelift scars. Some thinning in the area of the temporal region from a previous brow lift procedure can be improved by transplanting grafts into the area. As you can see in this young woman, she was delighted with that. We can improve the scars that may exist along the hairline, which has prevented the patient from wearing her hair up and back, by simply a well-executed FUE procedure. We're individually planting those follicles both within and just in front of that hairline. The other exciting things about hair restoration are that we're using these FUE methods to recreate a beard and a mustache. This is a gentleman who just never really was able to grow a very good beard or a mustache, and he was delighted with having hair restoration to be used to reconstruct his beard and mustache. Another area where I feel that the FUE method can provide significant improvement for patients is in burn scar hair restoration. This was an unfortunate lady that during World War II in Nazi Germany did not get very good health care and had burn scars that had just healed with very poor scant hair growth. She saw us and she underwent an FUE procedure utilizing the NeoGraft device to both harvest and implant the grafts in, and this shows her now finally being able to wear her hair in a natural contour, which she was delighted about. Another unfortunate patient who had chemotherapy and lost her hair, and unfortunately her hair never grew back several years later. And this shows her after she had an FUE hair restoration procedure. It obviously was a life-changing experience for her and for us as well. So one of the things about hair restoration, if it's a field that you're interested in getting into, which I would encourage many of you to do, the Venus Concept as a company now actually owns both the devices, the NeoGraft as well as the ARTAS. And there are very well designed and trained and intensive courses for those that are interested in hair restoration. We have a 2-day course in La Jolla, and also my colleague, Dr. Jack Fisher in Nashville, has a similar course where it was 1-day course of clinical and surgical watching a live procedure and another day of marketing and sales integration. So I really do feel like this is a comprehensive solution. We see that I feel like these are two of the leading FUE products available today. There is good preceptorship clinical training. There is a program that will help to bring assistants in to help set up your practice. There are marketing tools and business development and training. So some of the other information that's very helpful is there are patient intake forms available for both the ARTAS and the NeoGraft, which includes not only an intake form, but instructions before and after the procedure, which you can customize to your own needs in your own practice. There are these starter marketing kits, help with digital campaigns, the download center where you can go and access much of this information, and a physician or clinic finder. The ARTAS has a starter marketing kit that includes brochures and posters and other materials to be able to utilize in your practice to make patients aware. And the same thing with NeoGraft. I think very well designed and thought out marketing materials that look good and will educate your patient base about this service that you provide. As we said, there's an online store and a download center as well. I want to take a couple of minutes to also give you a peek into where the future may be heading in hair restoration. I'm the medical advisor to a local biotech company here in La Jolla, Stemson Therapeutics, and we have been looking at trying to create a regenerative model for hair restoration that may not necessarily utilize a patient's own follicles, Our goal is to collect the patient's blood or skin or hair sample and then generate patient-specific induced pluripotential stem cells or iPSCs that we can then differentiate into the dermal papillae cells and the epithelial stem cells, which are the workhorses of the hair follicle, place those into a construct that's a biodegradable construct into the scalp, and then create hair follicles. We've actually been able to do this in a mouse model, a nude mouse model, where we've been able to take human-induced pluripotential stem cells, coax those into the epithelial and dermal papillae cells, and seeded this into a biodegradable scaffold and actually transplanted this into the nude mouse. And this just shows the type of scaffolding that's been created. You can see on the lower right corner, day one, you begin to see the cells growing in the bucket, and then they begin to grow up through the tubing and out through the surface of the scalp. And this shows that these were the mice that were followed out for a period of 50 days, and you can see that the hairs actually grew, and from flow cytometry and DNA immunohistochemical studies, we were able to certainly demonstrate that hair growth had occurred. And this is our future roadmap. We're looking at ways to develop an autologous solution for patient-specific cell lines, and perhaps even an allogeneic solution for master cell lines in the future as well. So why add hair restoration to your practice? I think it's a natural fit for both dermatologists and plastic surgeons. We certainly all have the patient base to support it. It's great to keep this in-house within our own network, our own practice. We all already have established professional reputations that will take advantage of adding something like hair restoration into our armamentarium. We've already seen there's a very large growing male aesthetic market. This is certainly an aesthetic procedure which is creative and evolving. We'll be getting referrals from our colleagues. And beyond that, it's really fun. It's rewarding. So I'd encourage all of you to consider that. Thank you for your time. And any questions, feel free to email me. That's my WhatsApp number. And have a wonderful meeting. Thanks again for the opportunity.